Hi, my name is Dr. Austin Byrum. I'm one of the optometrists with the Health and Wellness Centers here in the area. I'm here today to talk to you a little bit about diabetes and how it affects the eye. Diabetes is a really common condition, especially in this area of the country. It involves the body's inability to regulate your blood sugar levels properly. If this blood sugar gets too high, it can actually start to damage parts of your body. And funnily enough, one of the first things that is commonly affected is the eyes. So one of the best things that you can do to catch this early is to see your local eye doctor every year for an annual dilated eye exam. Some of the things that we'll be looking for includes some eye diseases that can be promoted from diabetes. So the most common one is probably diabetic retinopathy. This involves blood vessels within the eye becoming weakened from the high blood sugar levels and then leading to bleeding inside of the eye. If this gets out of hand, it can lead to something called diabetic macular edema, which involves swelling in the macula or the central area of the eye. And this is where you get most of your color vision or your detailed sharp vision. So if this area gets swollen, it's definitely going to cause some vision loss. A couple of other conditions that can be caused by diabetes is glaucoma and cataracts. Glaucoma is a disease where the eye itself has a pressure spike and it can lead to damage in the optic nerve. And commonly this will first affect your peripheral vision. You'll start to lose your vision out here, but if left out of control, it can slowly shrink down to the central area as well. And then something that happens to everybody eventually is cataracts. However, if you do have diabetes, you're likely to have cataracts a lot sooner than someone who doesn't. The typical age for cataracts is about 65, but I've had many people with diabetes have them around 40 or 50, and sometimes even earlier than that. Diabetes can promote these eye diseases at any age, but the longer that you have diabetes, the more likely you are to have these eye conditions. Let's say someone who's had diabetes for 5 years has about a 10% chance of having an eye condition. However, somebody who's had it for 15 or more years has about an 80% chance of having these eye conditions. A couple of other things that can contribute to these are high blood pressure, high cholesterol, and smoking. So the best thing that you can do is get with your primary care doctor to regulate these blood sugar levels through diet and exercise, the proper medications, and if you smoke, try to limit or completely stop your smoking. I know it's not an easy task to do, but that's a great first step in controlling the health, especially with the eyes. So a few things to watch out for as far as the eyes go if you have diabetes. If you have any fluctuating vision, especially if you notice that your vision gets really blurry when your blood sugar is high, or if you have flashes or floaters within the eyes that are irregular, any dark spots that pop up in your vision that remain there for several days, or especially if you have a curtain of black kind of filter down over your vision and just kind of hang out there, please contact your local eye doctor to have them check you out. The thing that I most recommend is having an annual dilated eye exam with your doctor. That's not the funnest thing to do in the world, to have your eyes dilated. It makes you a little bit blurry and sensitive to the sun. But it's very important for the doctor to be able to put those drops in to make your pupil wide enough to see inside of the eye and to possibly catch some of these eye conditions before they start to harm your vision. If you have any questions for us, please feel free to give us a call and we'll get back to you as soon as possible. And we'd love to see you here at the Health and Wellness Center. Thank you so much for your time, and God bless.